Tigray has one of the most challenging terrains in Ethiopia. About 4/5 of the land is mountainous. Neqsege is a district in Tigray that stretches down from the Semen Mountains and has rough terrain that is challenging to villagers and especially to pregnant mothers. Due to difficult geographic terrain that makes infrastructure development difficult and the effects of the conflict that has made access to health services extremely difficult for mothers, Neqsege has the highest maternal mortality rate in the region. And unfortunately, after the conflict, maternal mortality exponentially increased by 5-fold in the Tigray region.
Tigray was one of the regions that had relatively stronger health system, and maternal mortality was continuously declining. The war turned everything upside down. Maternal mortality went up to 840 per 100,000 live births. So the number before the war, just before the war, was 186. This clearly tells that a pregnant mother in Tigray would not fare well.
Neqsege in particular has an even higher maternal mortality rate of 3,634 deaths per 100,000 births. In addition to the challenging terrain, the destruction of over 90% of health facilities during the conflict resulted in a significant decline in women's access to sexual and reproductive healthcare services.
منجدي لا ولدا منجدي هندي شجر لا بزحن ورودم لا بزحن بيتلي زنا عرنا بيتلي زنا دمنا الحقات جن وقلتي عقيس لنا منجدي أنزولا كأجمر لنا منجد ولد لا تعود لنا جزء خلا ويدم وحدت ويتهزأن
When their due dates are approaching, pregnant mothers in Neqsege are offered a stay at maternal waiting homes. These homes play a key role in preventing maternal mortality and in ensuring that all mothers have adequate access to health services. Maternity waiting homes are common residential facilities located near or at health facilities where women who are considered high risk or who live far away from the health facilities can stay towards the end of their pregnancy and after birth so that they can get timely access to skilled birth, essential childbirth care, and care during complications. Studies in Ethiopia show that individuals who utilize maternal waiting homes are 80 to 91% less likely to die than their non-user counterparts. In addition, there's a 73 to 83% less occurrence of stillbirth compared to non-users of maternal waiting homes. Waiting homes offer accommodations for mothers, their young children, and a caregiver of their choice. They provide meals, medical care, health education, and delivery preparedness kits, including locally prepared flour for post-delivery porridge.
حقستي أمانة قدمت بلا سأن حكمنا مرمرة بقدم أسلوب ودي أدنار خو قلت فخيدة تقدم سيخره ولديات رفاية وخذ نقص تحاورني نقو غير ياسر بلعخو